Type 2 diabetes can be self-managed to reduce the risk of heart disease, kidney failure and premature death. And whilst face-to-face advice is beneficial, many people with diabetes are going online instead. The eHealth unit at University College London has developed a digital health intervention that is successfully increasing uptake and reducing costs to the NHS.
So you're obviously checking your blood pressure at home and you're putting your results into your own record here.
Nikki Whitaker has been living with type 2 diabetes for decades. She sees a clinician every 6 months, but also uses this website, Help Diabetes. It allows her to self-manage her condition between visits, to find out information, talk to others, and even add her own test results.
It helps keep monitoring in the forefront of my mind. Obviously, I monitor my blood sugars regularly anyway, but it helps me to focus on possible changes in activity. You can set goals, make plans for change.
Within a consultation, you might be very tight for time. I often use this alongside a consultation, so we can start a conversation and I can show people how to set themselves a SMART goal, and then they can go away and continue to use that.
The website has been developed by University College London, which runs an internationally acclaimed eHealth unit. It develops, tests and implements the latest technologies to improve the health of people who are living longer with long-term conditions. By 2025, it's estimated that 5 million people will have diabetes in the UK, putting a massive strain on the NHS.
We licence Help Diabetes to CCGs for a flat fee, which is a third of the normal cost of group-based education. And that flat fee gives everybody in that CCG who has type 2 diabetes access to our intervention.
Kingshuk Pal is a GP. He's been trialling Help Diabetes on some of his patients. 50% of visits to the website happen outside office hours.
It's a chronic condition that people are living with, 24/7. So that's 8,760 hours a year that they're looking after themselves. The time they spend with health professionals is maybe half an hour. So it's really a drop in the ocean. So what patients do for themselves has a much bigger impact on outcomes than anything that we can do for them.
The website has been designed with the help of patients and their families.
We have done some pilot work which shows that people who use Help Diabetes over 6 weeks, by the end of the 6 weeks usage, are less distressed as measured by the problem areas and diabetes scale than they were at the beginning of the study.
Much of this evidence-based research is funded by the National Institute for Health Research. The eHealth unit is also reviewing digital media for sexual health and alcohol, where group sessions can be intimidating, so the anonymity of the internet helps. This website for men spreads the safe sex message.
There's a big hunger for more information and help, and clinics just can't cope with the demand. They really can't. So people find it embarrassing. Clinicians often find it awkward talking about sexual health problems. And the website looks extremely promising as a way forward. Again, not to replace face-to-face advice, but definitely as a supplement, and to reach people who just won't be receiving any help at all, actually.
Down Your Drink is a website developed to reduce harmful drinking. Research trials by the eHealth unit showed it cut alcohol consumption by around a half, and this was maintained a year on. The unit is now working on the website Help Alcohol to reduce excessive drinking.
What they're also telling us is that the tone in which the website is written is very encouraging and very supporting. Nobody's lecturing to them and saying, you should be drinking less, you're a bad person for drinking so much. It's very supportive, very encouraging.
This is healthcare reimagined, but clinicians need to learn to embrace these technological advances and empower their patients to take care of themselves. It's never easy to change habits, but the potential of eHealth is far-reaching.
I went into general practice because I wanted to help patients, and I think one of the really satisfying things about running an eHealth research unit is that I also help patients, and I can help more people through my research than I can as a face-to-face GP.